to Speak Our Minds, the fight for youth mental health, the podcast that delves into the inspiring journey of youth mental health advocates who took a stand and transformed a system. Together with your host, Heidi Baskefield, we'll explore the landmark lawsuit that held the state of Colorado accountable for failing to provide essential youth mental health services and won. In each episode, we'll unpack the intricate details of the lawsuit, guiding you through the legal battles and the monumental settlement that set the foundation for a working system of mental health. We'll examine the steps Colorado is now taking to build a comprehensive and effective mental health care system for its youth, highlighting both the challenges and the triumphs along the way. Join us as we learn from experts in other states who have successfully navigated similar crises, offering invaluable insights and strategies. Hear firsthand accounts from parents, providers, and professionals who are deeply committed to ending Colorado's youth mental health crisis. Their stories and perspectives will shed light on the impact of the lawsuit and the hopeful path forward. Whether you're a concerned parent, a mental health professional, or an advocate for change, this podcast is your guide to understanding the profound transformation taking place in Colorado's youth mental health landscape. Welcome to Speak Our Minds, the fight for youth mental health. Let's embark on this journey together.
Today, I'm so excited to have Senator Barb Kirkmeyer as our guest. Senator Kirkmeyer has been a long-time champion, not only for kids and families, but for local municipalities and her own home county of Weld County. And so we're so really thrilled to have you, Senator Kirkmeyer, here today. Thanks for making the time.
Yeah, thank you for having me. I appreciate being able to have this conversation. I think it's extremely important.
Thanks. You've been a public servant for a little bit. What inspired you to go this route? I mean, it's not an easy job.
I have been. I started back in 1992 when, or maybe a little bit before that, when I started getting really truly engaged in my community because of things that were happening down in my neck of the woods. And when I say down in my neck of the woods, I live about 45 miles from the county seat. And we were having a lot of things, just issues. And I just couldn't get the right response from my county commissioner. And so I decided to run against him. And that's why I just got engaged, became active in my community, and thought, you know what? We do matter down here. We do count, and you do have to listen to us.
I don't even know how to properly articulate how much I love that, but every sort of aspect of that story I love. And honestly, Senator, you've been a force ever since.
Great. It's great to have you here.
Another thing that's unique about your role is that you're a Republican in a state that is increasingly Democratic with respect to who's sitting down in the Capitol building with you. I don't think that's an easy dynamic. What's it like working in this environment, and how do you continue to be so effective?
You know, the thing is, I come from a background of being a county commissioner, and I served in the county commissioner role for a total of 20 years. I did a couple of different terms in there. And you know, from the county commissioner perspective, everything's bipartisan. I mean, there's not a whole lot of partisanship that goes on. Granted, in Weld County, all 5 county commissioners were Republican, but you're still working with county commissioners across the state. And I'm just a person who wants to get stuff done. And it's about governing, and it's about doing what's right by the people who live in our state, in our community, and in my county. And so when I became a state senator, you know, I approached it pretty much the same way as approaching my county commissioner position. And it was, you go out and you develop relationships throughout the state with other people.
Senator, without naming names, one of your legislative colleagues who is on the Democratic side of the aisle said to me, well, Senator Kirkmeyer is literally the most influential legislator down in the state house right now. What do you think when I say that to you? Does it feel like that?
I don't know. First of all, I'm humbled and honored by that comment. But again, I'm just about getting my job done. And my job is I feel it's to make a difference for the people who live in the state of Colorado, to really promote good governance, good policy that brings forward for everyone in the state. And that's just my job. So I'm grateful for that. I have a lot of friends who are on the other side of the aisle Doesn't mean that I agree with them 100%, but I don't agree with all the Republicans down there 100% either. And I've said this several times in the well, just because I'm elected from a certain district in the state, sure, I'm going to make sure and represent them, but I'm here to serve all of the people in the state of Colorado. That's my job. I don't have to be here. I'm here because I want to be here and because I want to make a difference.
And when you talk about being effective in this space, that really, I want to start to talk to you now about the issue of system reform and youth mental health, because last year you were one of the prime champions for Senate Bill 59, which was really seeking to overhaul the system of youth mental health care in Colorado. That bill never made it to the governor's desk, but it traveled a long distance and looked very much like it was going to get there. Can you talk about why you took on this cause and why such a significant policy lift is so important to you?
Sure. And before I answer that question, I'm just going to say the Senate Bill 59 didn't make it to the governor's desk, but the most important parts of that system of care bill, I actually ended up including in my high acuity bed bill, which was 1038, House Bill 1038. And so to me, the most important parts to get this started got included in a bill and got signed into law. So that was extremely important. So even though I sit on the Joint Budget Committee last year, in 2023, we had the Child Welfare Interim Committee. And again, as a county commissioner, I served on the Child Welfare Allocation Committee several times as chair. I mean, that was a committee that started back when I worked with Senator Rizzuto way back in the 90s to get that committee put together. And I was really involved in human services issues because, again, that's the role of a county commissioner. And so I just took it on because I just felt it was extremely important. You know, from my perspective, there are certain things that government should do, and they should do things for which, people can't do for themselves. If there's anyone who can't do things for themselves, is a child who has been pushed, shoved, or entered into the child welfare system for whatever reason, who are very vulnerable. And I just think that that is a role of government to provide the care and resources and services that these children need. So that's one of the reasons why I get involved, because that's extremely important to me, as a mom and as a grandmother. And I know a lot of other people are there too, and then from a county perspective, it's a high cost center. And so there has to be a balance between, what we need to be doing, how are we going to be efficient and effective, and at the same time, make sure that we're able to make that work within our budget and that's, a priority. So even as a county commissioner, even as being on the Joint Budget Committee, those are things that I'm constantly trying to balance. But again, when people ask me, what are your priorities on the Joint Budget Committee, I say education, higher education, Medicaid provider rates, and then child welfare in that order. Because those are things we have to fund. So I got involved. I actually asked to be on the Child Welfare Interim Committee. Most people don't do that because it's just not their area. And there's a lot of, I'm not going to say it's the most glamorous. It's not the most glamorous of, committees to be on. A lot of people, it takes a lot of work, but I will tell you, back in the 90s, I just got immersed in it and I just thought, we've got to be doing this. This is something that is supposed to be my job as a county commissioner. I'm going to get involved. I care about this area. I'm going to get involved. And so I feel the same way as a state senator, and being on the Joint Budget Committee, understanding really kind of the ins and outs of the budgeting portion of budgeting side of all these issues, that I'm just going to get involved because this is something that I feel very passionate about. So I got on the Child Welfare Interim Committee. I was the only Republican senator on that committee. So for all of those bills to be bipartisan, I put my name on all of them because we had 5 bills that came out of there. And I thought, I'm just going to put my name on all of them.
Right.
Someone asked me, it's like, how are you going to explain all those bills? I'm like, I got that part. That part I already know. I can understand that part pretty easily. And I've got a really great director, and I still call her my director out of Weld County, Jamie Ulrich, who I can contact at 5:30 in the morning and say, ask her about bills or ask her about things, and we can have some really great conversation. So that's why I get involved. It's a passion of mine, and I think it's not only a passion, but it's a responsibility. And these kids are people that we do have a responsibility as a government to provide for.
Well, I definitely agree. And after your journeys with both Senate Bill 59 and House Bill 1038, what's your observation, or how would you describe what you sort of see as the system of youth mental health care in Colorado at this point?
Well, right now, the whole premise behind the system of care legislation and trying to create that system of care was to get beyond just treating children for behavioral health needs, because it's about treating children for behavioral health needs and children and youth. So up to 18, 21 years of age, however we make it work. But it's not just about kids who are on Medicaid or underinsured or uninsured, but it includes all children in our state, whether they're on Medicaid, they meet those criteria, they're underinsured, uninsured, or on private insurance. Because the last thing we want to do is push a child into the child welfare system. Because when we do that, it greatly impacts in a very negative way their ability to be successful adults contributing to our society. It just does.
Yep.
I'm not saying children who are in the child welfare system don't grow up to be great adults, because a lot of them do, but it's a lot harder road to go.
Right.
And so we don't want to be pushing children into the child welfare system. So the system of care bill really was about how do we address behavioral health needs of all children, regardless of their insurance status, regardless if they're on Medicaid. Quite frankly, the last thing we want to do is a child whose parents are just at the end of their ropes because of the behavioral health needs that their child needs and has, and that their private insurance won't cover anymore. And the only way they can get the resources for their child is to relinquish some of their rights and get them on Medicaid. And that's the last thing we want to do. We don't want them in the child welfare system. That's not good for them. It's not good for their family. And it's not necessarily what parents want, but they're just at the end of their ropes and they want to try and get their children then all the services that they can to help them out. And so a system of care, like I said, it really is to address all of those needs. And granted, we need to maybe start a little bit smaller and start, with the Medicaid system and the uninsured and the underinsured. But at some point, we need to be addressing the needs of all of our kids and youth, because we do have a behavioral health, I don't want to say crisis, but certainly challenges in our state that we need to address for our youth. And I think that will help kind of change this whole generational cycle that keeps happening, that keeps people in poverty, that keeps people in these systems where I don't think they want to be there. We should be assisting there.
Senator, as you were working on both pieces of legislation, the issue of the EPSDT class action lawsuit involving HCPF and Medicaid definitely came up, and as well as the settlement agreement to sort of say, instead of perhaps moving Senate Bill 59 in its current form, we use the settlement agreement as the mechanism by which we drive change. And I'm curious, to what degree has the department, given your commitment to this body of work and your engagement on all of this so far, to what degree is the department directly partnering with you in its work on ensuring for a successful approach to the creation of its implementation plan to address these issues? Where do things stand in the conversations between you and the department with this body of work?
So I'm assuming you're talking about the Department of Healthcare Policy and Finance, or
Yes.
maybe you're talking about Behavioral Health Administration, or even the Department of Human Services. I mean, they're all three. Yeah, mostly HCPF, the Department of Healthcare Policy and Finance. They all three should be involved. They all three have a role. However, I mean, we have a Behavioral Health Administration. They should be involved. But the Healthcare Policy and Finance has been nothing but a roadblock and put up barriers throughout the whole process. And they don't really like to share much. I think their executive director, while I think she's a very intelligent woman, I think that she wants to be in control and likes to hide things and doesn't like to let people know how bad things are. The whole purpose of the system of care, when we were putting this together, it came from the counties. And Weld County my county had been taking the lead on this, and they had hired a consultant who had worked in the state of New Jersey and put together system care there, which is a very successful system of care. They have twice as many children as we have in our state, and their system of care is very efficient and it works. And granted, it's been around for a little bit longer, but it came about because of a lawsuit very similar to the lawsuit that the state of Colorado faced. It came up with a consent decree, I guess. I don't really even know exactly what's all in that consent decree. Healthcare policy and finance is very secretive in my book, and they like to do a lot of things behind closed doors, which causes problems. So that's why when we were in the Child Welfare Interim Committee and we started talking about this bill, they didn't like it, and neither did the Department of Human Services. They didn't want to have to deal with it. They didn't want to be open, transparent, and try and develop partners to figure out a way on how do we improve the behavioral health system for our children and youth in the state of Colorado, which I find just very disappointing. That's the word I'm going to use today. It was extremely disappointing. In fact, it got to the point where the system of care bill, when it came out of the Child Welfare Interim Committee, was one of our 5 bills, and it passed out unanimously. And the Department of Healthcare Policy and Finance and the Department of Human Services and the Behavioral Health Administration, all 3 of them decided to put a huge fiscal note on it. I mean, I'm not sure exactly which one of those areas, which agency was the most responsible, but I'm thinking it should have been Behavioral Health Administration. But if they let Healthcare Policy and Finance do it, they did it at their own detriment. But they put a $1.1 billion fiscal note on the bill. I don't know if they thought that was funny, but I do know they thought that would kill the bill. I was able to, working with, again, folks from the counties and from the County Directors Association, and having some pretty strong discussions with these departments and with the fiscal analysts. First of all, I got it down to about 300 million, which is still really high. And at some point, this is going to cost us money.
Yes.
But we're spending a lot of money anyways on all of these things.
Right.
And the whole system of care bill was about putting together an implementation plan, putting together a team. Let's bring in all the partners. Let's not just keep doing this stuff behind closed doors and from the state top down, who doesn't implement anything, quite frankly, putting this all together that way. But anyways, we were able to, on first blush, I got it down to less than 300 million. And when I was talking to the folks in the Human Services and Health and Human Services Committee, the senators there, because that's where the bill went first, I told them, I said, I'm going to get this down even lower, but I need you to pass it for me to do that. So they understand we're serious, that we are going to start putting together a system of care and how we're going to implement in this state to take care of our children and our youth's behavioral health needs. And it came out of that committee unanimously as well. Then I think I had to go to finance next, or appropriations, one of them. I can't remember how many committees I went to, but it seemed like an awful lot. But even in finance, at that point, I was able to get it down to $2 million. It was either finance or appropriations. I just really can't remember at this point. But I got the cost down to $2 million. And being on the Joint Budget Committee and with Senator Zenzinger and Representative Byrd and the others, but sincerely with their help, we set aside the $2 million in the budget specifically for it. So not only did I get the fiscal note down from 1.1 billion down to 2 million, and said, no, the whole thing behind this is, let's put together a leadership team, let's put together an implementation planning team, and let's put together the plan and then start figuring out what the costs are and how we phase that in, how we stair step our way to getting to a true system of care similar to what is in the state of New Jersey. And so that's how I was able to get it down to the $2 million cost, able to convince my colleagues on the Joint Budget Committee to put the $2 million in the budget as a set aside. So go through appropriations, get it out of there unanimously. On the Senate floor, I don't know that it was unanimous, but it was certainly overwhelmingly, I don't remember what the vote was, but it was certainly overwhelmingly supported by both Republicans and Democrats, and get it off the floor. We get it over to the House, and in the first committee, there was direction given to the Democrats on that committee to kill the bill. And it came from the state somewhere, either through the governor's office or the State Department's lobbyists, which means it still came from the governor's office because they have to clear that stuff. I mean, I worked for a governor, so I know how it works. And very disappointing again. In fact, I was really upset. And I still had my other bill, the high acuity bill, opened out there. I just had gotten it passed through its first committee and had to send it was going to appropriations. So like I said before, I took the portions of the system of care bill that required them to put together a leadership team and an implementation team to develop a plan on how we would create the system of care in the state of Colorado, put that all together and put that in the bill, the high acuity bill, and got it passed in the last couple of days of session.
Yeah.
And they couldn't kill it. But how disappointing. These departments are supposed to be working with counties and working with all the other stakeholders on how we provide behavioral health, mental health to resources to the people of Colorado, and all they were doing is putting up barriers because they were trying to protect themselves, essentially. They didn't want anybody interfering with how they determined that we should deal with the consent decree, with the lawsuit, which is why probably we end up in so many lawsuits in the first place. If they would open that up, be more transparent, and actually develop partnerships instead of doing what I call stakeholder meetings, we would have gotten there, and we could have gotten there sooner, and we could have gotten there in a partnership. I know you've got other questions, but I'm just going to say this. I am so upset with them. They were supposed to create and convene an implementation team by October 1st. That hasn't happened. They started talking, people are appointing people, but they haven't actually convened an implementation team, because I just checked. That's part of the reason why I was late getting on your podcast. The other thing is they're supposed to create a leadership team, which they do not want to create, because the leadership team has the ability to really provide more than just feedback, but assist with the decision-making process. And God forbid somebody should tell these state departments how to actually operate and make things work in this state. So they haven't done that either. And that has to be done by November 1st. They were supposed to create rules, start creating the rules for the system of care. That was supposed to happen by October 1st. They got it done. It's 2 pages worth of rules for a system of care to implement in our state that is extremely important. Only 2 pages. In barriers that they have put up, it's extremely frustrating. But one other thing I was able to put in the bill that I added on at the very last minute is that they have to report to the JBC on a quarterly basis and give us updates on what's going on the system of care. Because again, I know it's going to cost a lot of money, but I also want to know what the heck they're doing over there. And so far, I don't think they're following through in getting their job done. So I'll be talking to them pretty sternly, I'm pretty sure, in January.
Well, Senator Kirkmeyer, anyone who hears this is going to feel the amount of frustration that you have here. And given that I got to be part of the group that initiated the lawsuit, I similarly feel the frustration about how things have evolved. And one of the other things that occurs to me is that when you have an agreement on a massive lawsuit that is ultimately likely going to cost the state up to $300 million new dollars, especially at a time when our budget is constrained and not growing, that you would have things like a full briefing of the Joint Budget Committee, or even at the caucus level, sharing the outcome of the lawsuit, the obligation of the agreement, and what legislators should anticipate coming as a result of this. And to my understanding, nothing like that has happened, unless I've missed something. Has it?
No, you're correct. That has not happened, at least not with the Joint Budget Committee. We get bits and pieces, but I don't have a copy of the consent decree.
How is that possible? How is that?
Because they're the executive branch and we're the legislative branch, and they don't think they have to share all that with us. So I'm just probably going to have to do a core request at some point, but I am going to ask for that information. I've asked for, it took them, 6 weeks to answer questions from before. I asked more questions at the last forecast. I had to write them out. I'm like, why aren't they writing them down? But I had to write them out, get them to them. And that was September 19th. What day are we on? Somewhere in October. I still haven't received responses to those questions. So it's not going to be a happy time for anybody come January. That's just all I have to say. If they think I'm going to let go of this, they're wrong. I was extremely frustrated, extremely angry, upset when they put a $1.1 billion fiscal note just to kill a bill. Just to kill a bill, because they don't want anybody involved in their business, is how they think about it. That's just wrong. I'm willing to work with the governor's office when they're willing to work with me, but when they want to put up roadblocks, I'm just going to go after them. I'm just going to have to go find it, go after them, and try and work and straighten it out from the Joint Budget Committee angle, which is a good place to be from my perspective, for me, not necessarily for them, because it's frustrating. It doesn't have to be this way. Aren't we all supposed to be working together in the best interest of the people of the state of Colorado? There are times, I'm not saying I'm perfect and I haven't screwed up at times, but I don't sit there and try and figure out how to just protect my backside. I try to figure out how to go fix it. And they're just all about, it's like hiding stuff and hiding information, not giving all the information, not answering the questions fully, taking a long time to answer questions. It's very frustrating. And again, it doesn't have to be this way. This is not how government is supposed to operate. It's not how we operated as counties. It's not how the state should operate. And they should really figure out that I can either be their best partner or I can be their nightmare.
And I think to that point, I agree with you completely that this could be going so smoothly and could be generating impacts for the people that you and I are trying to make a difference for, which are these kids living in hospital emergency rooms.
Yeah.
And having to have parents surrender custody to get services. I mean, none of that has to happen. And while I do think there are people within the departments that are trying to be helpful, if the leadership of the departments isn't taking that seriously and advancing that as a priority, it won't matter how much other people inside those organizations try to bring about change.
That's exactly right. And I think it's just sad that we have to have lawsuits. There's no reason we have to go through the expense of a lawsuit. I mean, that cost you. If you were the one who brought forward a lawsuit, that cost your organization. It costs the state, and it costs the people that we're supposed to be serving. Because instead of putting that money towards the people that we're supposed to be serving, we're now tied up in court. Like, why? I mean, and the whole thing is you get to a consent decree, which means they have to come to some kind of middle ground that says, yeah, we're going to do all this so you can drop the lawsuit or so we can get out of this lawsuit. And why can't we just get there in the first place? I've never understood that, because it's happened more than once in my career.
Yes.
And why do we have to, do we have to have another lawsuit? I mean, that's just wrong. And again, what happened to just like trying to be a good government and trying to be good at governing and trying to really look out for the citizens that we serve instead of just looking out for ourselves? Because that's how it feels from my perspective. And maybe they're not doing that, but it sure does feel that way from my perspective, that they're just looking out and trying to cover for their own department so that they don't look bad. And then they put out these fake narratives all the time about how great they are. And I'm like, if you're not great, please don't say so. Like, let's just work on it and let's get to great, where we are serving people. But they just don't want that, because to me, it's almost like a control issue. And from my perspective, I don't care. You know what? You can all take credit for anything. That doesn't matter to me. It's really more about getting the services to the kids, children and youth that need these services, and making sure that they get to have the best life possible.
Right. Where do you think your colleagues are going to be on this topic when it comes up in January?
I don't even know who all my colleagues are going to be yet in January.
Right.
But,
well, there's that.
I think some of them will still be there. And I think they will understand. And the reason I say that, so Senator Zenzinger won't be there because she is term limited and she's moving on probably to become a county commissioner instead of a state senator. But Senator Bridges will be there. And I believe so will Representative Byrd. And I will say this about Senator Bridges. When I contacted him and I told him and said they killed the system of care bill last night, he couldn't believe it. And he's like, why? He goes, we had the money. And he goes, and you were working with everybody. And I said, exactly. I said, because they don't want us to do it, because then they'll have to be transparent and open about things. And they know I'm going to dig in. And I said, but I'm going to do an amendment in appropriations on the high acuity bill. And he's the chair of appropriations. He's like, okay, I'll support it. And I told him basically I was taking out the parts of the system of care bill, to create these teams to make sure that we start the planning part of this. And he's like, okay, he goes, I'll support it. And he said, okay, well, it's going to be more than a page long, so I'll need appropriations to meet tomorrow. And he's like, okay, we'll do that. And I was like, all right, thank you. So the appropriations committee voted unanimously. So I think just from that, I think they'll be supportive because they supported putting this into another bill. And we were like in the last couple of days of session. So they were very supportive of that. And I think Senator Bridges, who I'm hopeful that he'll be the chair of the Joint Budget Committee, I think he'll be supportive and he gets it as well. And so I think that will be very helpful. I think my other colleagues usually are pretty good about seeing kind of what's going on. And as long as it's not like extremely costly or we are trying to figure out how to pay for, these things in the future, now and in the future, they're usually pretty supportive of these kind of things.
Well, what I can say to you is that the people who are going through these experiences and not getting what they need appreciate your fearlessness in the conversation and your commitment and resiliency. So I just want to say to you on behalf of so many stakeholders that we continue to connect with and work to elevate their experience and their voice. Thank you for being there, for being the open door that people can talk about this with, and for not backing down in the face of challenging dynamics with state departments, because they're exhausting. Those dynamics are exhausting. And sort of the playbook has been to just wait it out. And eventually you'll get so tired, you'll stop. And it will continue to come at the cost of these kids. And so thank you for not giving up and for looking forward to yet another legislative session where you will be a champion for them.
Well, thank you for that. And I will just say this. Thank you to all of the folks who keep staying engaged, all the stakeholders, all the organizations, all the just regular parents who just want to help their own child and advocate for their own child. I'm sincerely grateful for all of you. It's a team effort. No one ever does these things by themselves. So it's truly a team effort. You know, when folks come in and tell their stories in the committees, like Commissioner Scott James, I know his story because I worked with him and I know his family's story. It's inspiring to me when I see parents and outside organizations who are just really there to advocate for these children that are in the state of Colorado. So thank you to everyone else, because we're going to get it done. We all are going to do it together. And when one of us is down, the other one will pull us all back up and help inspire us to keep going forward. So thank you very much.
Thank you, Senator, for joining us. And I hope you'll come back at some point during the session and give us an update and keep talking to us about how things are going, how people can be involved, and how people can support you as such a strong advocate.
Absolutely. Thank you so much. Thanks for having me on today. Appreciate
Thank you.
Thank you for joining us on this episode of Speak Our Minds, the fight for youth mental health. We hope you found today's discussion insightful and inspiring. The journey to transform Colorado's youth mental health system is far from over, and your engagement and support are crucial in sustaining this momentum. If you have any questions, comments, or stories you'd like to share, we'd love to hear from you. Connect with us on social media or visit our website at www.speakourminds.org for more resources and information on how you can get involved. Don't forget to subscribe to the podcast on your favorite platform so you never miss an episode. Together, we can make a difference and ensure that every young person in Colorado has access to the mental health care they need and deserve. Until next time, stay informed, stay engaged, and keep advocating for a brighter future. The Fight for Youth Mental Health with your host, Heidi Baskfield. Thank you for listening.